So breast cancer is basically the formation of malignant cells or cancer cells in the breast tissue itself. 1 in 8 women will be diagnosed with breast cancer in their lifetime. It is the second leading cause of cancer death for women, and basically 1 in 39 women will die of breast cancer. So it does predominantly affect women over 50, but it does affect men too, and we have had several younger patients diagnosed as well. Typically, the most common symptom is a lump that either the patient or the doctor feels. Some of the less common symptoms are like skin dimpling, a kind of like thickening or redness of the skin, or nipple discharge. Lowering your risk of breast cancer is sort of common sense. So living a healthy lifestyle, maintaining a healthy weight, not smoking, really limiting alcohol consumption, and trying to incorporate exercise. So breastfeeding does lower the risk of breast cancer. Basically, for every 12 months of breastfeeding, you're lowering your risk about 4.3%. Breast self-exam, I still think has a lot of value because nobody knows your body as well as you do. Monthly is ideal. So I try to tell women either time it to something that you know is going to happen every month, like your menstrual cycle. If you're not having menstrual cycles anymore, then just remember like the 1st or the 15th of the month. And the easiest way to do it is usually in the shower. So a mammogram is pretty simple. It's an X-ray picture of the breast. So a standard mammogram for a woman coming in who doesn't have any breast symptoms will be 2 views of each breast. If it's a woman that does have some symptoms, like she feels a lump or has nipple discharge, we may take a few additional pictures. October is Breast Cancer Awareness Month. Our office is offering low cost and cash pay mammograms, so you can contact us directly for pricing. So I think mammograms are more uncomfortable than they are painful. So the breast is in compression for each view. Because we do use the 3D mammogram, it's about 15 seconds of compression per view that we take. But our technologists are very well trained, and they do understand that it can be uncomfortable. And we do have some measures in place to help facilitate comfort for our patients and make it tolerable. So inflammatory breast cancer is a rare form of breast cancer that is very aggressive. So it's about 4% or so of breast cancers that are diagnosed are inflammatory. And typically the way it's going to present is that the breast kind of looks red and hot and swollen and sort of painful, almost like a breast infection. And it does get confused with breast infections sometimes, but that's why it's so important to get your mammogram done at a breast center where people really understand how to look for those subtleties so that they can tell the difference between the two. So a lot of it really does depend on your radiologist. So you kind of have to enter into it with a high level of suspicion. So I expect a breast infection in women typically who are breastfeeding. It does happen sometimes in active women, and it's just from basically sports bras and the nipple rubbing against that, and then a bacterial infection can start. So kind of in the absence of those, clinical scenarios, you really do have to consider inflammatory breast cancer in your diagnosis. A lot of times I'll see, pretty intense skin thickening on the mammogram, and usually there will be a mass that's associated with it. And that's typically how the diagnosis is made. Yes, it does. So the most important thing to know is basically first degree relatives. So your mom, your sister, and your daughter, if they had breast cancer premenopausal, so typically 50 or younger, that it will significantly increase your personal risk. So here at the Breast Center, we do calculate everybody's individual risk based upon a questionnaire that they fill out, and then we can make appropriate recommendations for additional screening. So smoking doesn't necessarily cause it, but we know that there is an association between smoking and breast cancer. So depending upon the kinds of studies that you read, somewhere between 14 to 28% increase in your risk of breast cancer development over your lifetime, depending upon when you started smoking and for how long and how much.
Okay.
It does, unfortunately, and it's only pretty small amounts. So it may be, that people are drinking significantly more than what they should be. So obviously abstinence is the best, but, we are realistic. So, but just so women are aware, even 1 to 2 drinks per day for a woman can increase your risk from 30 to 50%. So it's not insignificant. I mean, exercise is super important, not just, for your body's health, but for your mental health as well. But in terms of breast cancer specifically, there's about a 12 to 21% decreased risk of breast cancer in physically active women. And typically where we measure that is about 4 days of moderate activity, about like 30 minutes or so. The more you do, the more benefit you get. Women basically need to see their doctor once a year. Healthy women can see their doctor once a year and do their breast exam with their doctor. And then once you turn 40, if you're of average risk, that's when you should start doing your annual screening mammograms. That doesn't mean that you can ignore symptoms, though. So the kinds of things that we already talked about, like, feeling a lump, any changes in your skin, nipple discharge, you have to tell your doctor no matter what age you are, and you do need to come in for a diagnostic mammogram.